Hi, I'm Dr. Erica R. Jones, MD. I'm a board certified family medicine physician who's been practicing medicine for over 10 years. I graduated from Meharry Medical College in Nashville, Tennessee, and it's really been a privilege to practice medicine and to meet some amazing individuals and to work with some amazing individuals. Did you know that you are looking at a very rare individual? I need you to know that right here, yeah, I'm very rare. There are less than 3%, yeah, I said it, less than 3% of black female physicians in the United States of America. So I just need you to understand, what you're looking at when you're looking at me, right? So there are a lot of different specialties, when you talk about healthcare, when you talk about medicine. A family medicine physician can literally deliver a baby or take care of an older individual as they transition out of this life. Family medicine physicians have a wide scope of practice. So I'm going to be talking about some of the major healthcare issues that I deal with, some of the major healthcare issues that I see on the day to day, and hopefully I'll be able to provide some tips that might help you, that might help your wellness journey go a little bit smoother. That's what I'm here for. I'm here for the people. I need y'all to know I am here for you. So I just want to drop a couple of facts. Did you know black and Hispanic people are less likely to see a doctor for a preventative visit? And did you know that black and Hispanic people are more likely to delay actually going to see a doctor? And we actually, a lot of times, will avoid seeing a doctor due to cost. Yeah. It's one of those things that is very prevalent. So I try to provide tips so that you understand when you go and see a healthcare provider, what's going on and how to make your trip just a little smoother. I want to start off with just talking about the anxiety that some people have going to see the doctor or going to see the dentist. Because let me tell you, I still get a little bit anxious when I go to the dentist's office. The doctor's office, not so much. What about you? Let me know down in the comments if you actually get anxious or if you get scared or if you get nervous, like how you feel about actually coming to the doctor's office, right? I think the biggest thing that kind of irks me when I go to the doctor's office is thinking that I'm on time and then having to go all the way to the top of the parking garage. And then it's like, okay, wait, now I'm here. Which elevator do I get on? It can really be a hassle, especially in Atlanta, trying to go and see a healthcare provider. So hopefully the tips that I provide today will just help you have a smoother visit. One of the major things I want to talk about is showing up early. I'm one of those people. I'm from the South. My grandmother, my mother, they built into me. If you are on time, you are late, especially when it comes to the doctor's office. You never know what's going to happen with the elevator, with the parking, with the traffic. And those little time windows, they're really tight. So when you wonder why your doctor's late, you might want to start looking at the other people that were there before you. A lot of times it's not necessarily our fault. So outside of emphasizing trying to show up early for your appointments, I really want you to be prepared for your appointments when it comes to your preventative care. You know, a lot of times we will get blood work done, so you want to try and make sure you're hydrated, make sure you drink water, the night before, and just make sure that you understand it for your preventative visits or for your annual checkups, you're probably going to get some blood work done. So A lot of times we'll check your hemoglobin A1C, which is what we look for. It's an average of your blood sugars over about 3 months in an individual who has normal health. And that's when you find out if you have diabetes or pre-diabetes, or if you already had diabetes, how well it's being controlled. We look at your cholesterol levels, maybe even your thyroid levels. Sometimes we even check your vitamin D levels. So that's what happens at a preventative visit. You get the exam, you get the blood work, and I like to talk to patients about having access if you can. I understand sometimes all the apps and things can be a bit cumbersome, but just having access to your labs, so when you go back in for your follow-up visit, if you have questions, you can write those down. So you want to make notes. You want to talk about your major concerns when you go to see the doctor. So if you feel like, oh man, my back has been killing me, don't just come in there and say, oh, my back hurts. And don't make sure you have your specifics. So you want to talk about the onset. When did your back start hurting? You want to talk about the type of pain that you have. Is it sharp? Is it throbbing? Is it moving anywhere? Talk about what you did to make it feel better. I know how I am. I'm going to do something to make it feel better. If my back is hurting, I'm at least going to probably try to take a Tylenol. I'm going to go get some Freeze or something. I'm going to get a heating pad. I'm going to pull out a little yoga video. That's some of the things that I'm going to do if I'm dealing with back pain. 'Cause back pain is one of the most common reasons why people actually go to the doctor. So I'm going to try to do all the natural stuff that I can in most instances before I actually say, hey, doc, I think I need your help because I try X, Y, and Z. So just be very transparent with your healthcare provider when it comes to the things that you've tried. And also talk about if you've dealt with a problem before and what actually worked for you in the past. It's important to actually know what's going on with your body and to be in tune with your body so you can relay this to your healthcare professional that is trying to help you. It's Dr. Erica Jones. I'm just providing tips for you.